You had some questions about your daughter Lily, and I want to take this time to talk about your concerns with her ability to communicate with her Dynavox and our overall goals for therapy this semester. So our overall goal for Lily is that she become a competent communicator. And what we mean by competence is that she have enough of a key skill to be adequate and effectively able to communicate. So there are 4 key areas of competence that I want to go over with you real quick. We have linguistic competence, and that means that Lily have the ability to know the vocabulary that's on her system, and then also know the vocabulary that people are using in her environment. So this means she'll be able to communicate well with her teachers, her classmates, and her family as well. Once she has a good knowledge of the different vocabularies, she will have a good social competence. And social competence is how she interacts with different people. So this can be initiating conversation as well as terminating the conversation, or simply requesting an item. She could also reject an item or just make different choices. So once she has her linguistic and social competence, we should also talk about operational competence. Now, operational competence is how Lily operates and works her system. And this includes all the technological aspects of her Dynavox. So this can be something as simple as turning it on and off, or adjusting the volume, or just navigating between the different screens. So those 3 areas, linguistic, social, and operational, will make Lily a great communicator. But inevitably, she's going to have breakdowns, just as you and I will experience breakdowns in communication with others. So what we want is for her to know when those breakdowns happen, and then how to fix the breakdowns. And that is defined as strategic competence. Now, strategic competence is probably the most difficult to teach, and it's the most important for Lily especially. But for Lily, it's the most important because of her physical impairment of cerebral palsy. Now, first, she may be underestimated and she may be overlooked. And we don't want that to happen, so what we want to do is give her some compensatory strategies to overcome those challenges. Another reason it's so important is because Lily has limited mobility because of her physical impairment. And so when I'm using gestures to talk to you, she might not be able to use that. She also may not be able to point to different things to make choices and help get her message across. And the last reason it's so important is because Lily may come off as intimidating to her peers. And that's just simply because kids are not used to seeing other children that are not physically like themselves. So when Lily comes in with her wheelchair, her Dynavox, and all her different equipment, they might feel a little bit set aback by that. But we can give her strategies to overcome this. So we might give her an introduction strategy where she says, "Hi, my name is Lily. I use my Dynavox to speak and make choices." So that lets the kids know right off the bat why she has this Dynavox, and it lets her teachers know that as well. So with those 4 areas of competence, linguistic, social, operational, and strategic, Lily will be a great communicator. And strategic is the most important because it enhances all the other areas. So she'll have that ability to realize when breakdowns happen and understand really when to fix them. And overall, she'll be a competent communicator. Does that help you understand the goals for? Awesome. Cut.